interesting topic today. So let me first introduce our guest, Dr. Shilpa Rao Skirberg. All right? Yeah. She is a research professor at the Norwegian Institute of Public Health, working in the Division of Environmental Health. She has over 25 years of experience in modeling and risk assessment related to energy systems, air pollution, climate change, and health. Quite a large, wide array of systems there. And she is the lead author of Chapter 19 on climate and health in Working Group 2 of IPCC in the Impacts and Adaptation Working Group for the 7th Assessment Report. And she's a commissioner and steering group member in the ongoing Lancet Commission on Migration, Climate Change, and Health, Climate Change Commission, Lancet Migration. And we also have Dr. Sarath here, Sarath Guttikunda. He is the founder, director of UrbanEmissions.Info. You can just Google or type that in your web address, and you will that will get you there. In India, and adjunct professor at IIT Delhi. He conducts research in an independent capacity to support science, policy, and public dialogue on air pollution, for which he received the International Award by the AGU in 2022, along with me. Yeah, that's where I met Sharath. It was wonderful to be there with you, Sharath. So this presentation that Sharath will give is quite interesting. He has a bag full of goodies as well, cards and different kind of science communication materials. So his presentation pulls together lessons learned and information collated from studies conducted under their umbrella program, which is known as Air Pollution Knowledge Assessments, APNA, for cities. And he received his bachelor's in chemical engineering from IIT Kharagpur in 1997 and doctorate from the University of Iowa in 2002. And all the material, including emission inventories for India and Indian cities, are available for open use on their web portal. That is UrbanEmissions.Info. So let me welcome Dr. Shilpa to start with the dialogue and talk. Let's keep it interactive. So we are open to questions. Total, we have around 40-45 minutes for the talk and discussions. So, thank you.
Up there.
You can stand.
I can stand.
Yeah.
Everyone can hear me. Nice. Thank you very much for the invitation, and it's a great pleasure to be in Pune. I haven't been here since I was a child, so it's really nice to be back here after so many years. And thank you especially to Roxy for inviting me here. And I just took up a conversation with Roxy and thought it would be a good idea to come here, especially since you have also launched a lot of work on health these days with the Heat Health Network. And I was particularly interested in that angle. And so I'm very glad that you said yes. I chose the same topic as Sharath, although my slides might be slightly different. And I will give more of an overview presentation. I'm sure Sharath will have lots of good examples, especially from the Indian perspective, but my slides are more general on what I see as lacking in the literature and what are the new things that have happened in this field. So what I will do first is to talk about the IPCC 6th Assessment Report and what findings and evidence were found in the 6th Assessment Report. There's a lot of evidence found already in the 6th Assessment Report. And then I will talk about some new evidence from Europe. There's a lot of new evidence in the European setting, and I don't have time to deal with all of it today. There's so many publications that have been published in the past 3 years. I recently ran a search, and there are more than 6,000 publications in particular topics in this field just from Europe. So it's too much, but I will give a very brief overview of some of the interesting papers here. Some new evidence from India. Again, I'm doing an assessment. So obviously in the assessment, I have to look at literature from India. I have not published in with relation to India in quite a few years. But there's a lot of new evidence that's coming out that's very interesting. So I think I should also mention that. And then in the end, I will talk about some points for discussion. So the IPCC 6, this is a lot of text in the slides. Hopefully you can read it. But the 6th assessment report concluded with medium confidence that human-induced climate change has already caused an increase in observed health-related mortality globally. So this was already established, especially by a number of papers that came out in 2021. Based on that, it already established with medium confidence. It also states with very high confidence that extreme heat is a rapidly growing health risk. And this is driven by a number of factors, increasing temperature extremes, urbanization, and demographic changes. It also said that a significant fraction of observed heat-related mortality is directly linked to human-caused climate change. But this is something that is still a matter of contention. How much of the heat-related mortality is actually linked to climate change? And how much is something that would have anyway happened? And this is something that is receiving a lot of literature these days on attribution analysis. Most of the historical evidence that came from the IPCC looked at mortality that originated from developed countries, particularly Europe, North America, some parts of Australia, and also some studies already done in East Asia. But there were almost no studies taken into account from the South Asian region because there were no studies existing during the 6th assessment. And of course, there has been also a lot of issues on adaptation, and I'll talk about that in the next slide. This is similar to most of the regions which were projected to observe the most severe future increases in heat mortality are Central and South America, Southern Europe, Southern and Southeast Asia, and Africa. So this was said quite confidently that heat-related mortality will grow in these regions. These regions also experience a lot of urbanization. So heavy urbanization creates microclimate urban heat island effects, and I think Sharath will talk more about that. And of course, the world is aging, not so much in India at the moment, but it will eventually also here age. And this is considered to be a huge issue because mortality burdens increase as populations age in the future. And then, of course, there's the issue of outdoor workers already was cited during the Qatar, when the FIFA Games were held in Qatar. There was already a lot of debate on a lot of workers who had died or who were suffering heat-related exhaustion. So this has also been an issue that has come up in the past. So as I said, there are very few studies from tropical and subtropical regions, very few studies from low and middle income countries. So this is the first gap that we have identified as geographical and baseline differences in baseline issues for the IPCC AR6. I already talked about that. The compound impacts, this is something that is especially close to my heart. And this is also relates to the title of this presentation. So there has been very few studies that have looked at heat in relation to other kinds of hazards, in particular air pollution. Most of the studies have looked at only heat-related mortality, for example. But we all know that we don't just suffer from heat, we suffer from a number of issues together. And this can include air pollution in this example, but you can also have, for example, wildfire smoke, often an issue in Southern Europe, for example, or you can have pollen, which is often an issue in Norway, where I live these days. Pollen is a huge issue, lots of people suffering from allergies, and as climate change changes and the days get warmer, the pollen increases significantly, and this can be a huge burden, especially for children in particular. So this kind of siloed risk, this kind of risk, which is compounded, whatever you call it, there are various words how you can refer to it, but this has not been explored in great detail in the IPCC. There's also been relatively little literature on wet bulb temperature limits, for example, because heat always combined, when it's combined with humidity, there is always huge amounts of impacts related to that. And there's a huge physiological mechanism that happens when heat combines with humidity. And this has also received very little attention in the AR6. Adaptation has also not received as much importance. These days, adaptation has become a very buzzword, but adaptation is not straightforward to model. It includes a number of adaptations, like adaptation could be technological. It could be, for example, early warning systems are classic examples, nature-based measures, social measures. So all these adaptations are supposed to occur together for a city or a region to adequately adapt to increasing heat, for example. But there are very few studies that have actually looked at what kind of adaptation has happened. Have these adaptations been successful or not? This has been a huge issue. Do these adaptations actually reduce impacts? Because if they adapt, for example, early warning systems, if early warning systems were effective, there should be no deaths happening in Europe. But as I will show you this year, their projection of more than 10,000 deaths have already happened in Europe. Why should they happen if you're sending out early warning systems, early warnings to everybody? So there's something wrong. The early warnings are not working, and this has been a matter of debate on what is going wrong. Why do adaptations not work as we think they should work? The other thing that we've identified is that, the classic thing, what is the causality? How do you actually attribute heat and mortality together? And this has been a lot of, relation to this. There's also indirect effects of heat, for example, increases in suicide, interpersonal violence, and so on. And there's been huge amount of, debate on how do you actually attribute this to heat. This is something that is also receiving a lot of research and literature at the moment. And then the scenarios, which is a classic field again, what do you do? Which scenario should you take into account? And if global temperatures overshoot and then come back to the normal, what does this mean? Will the structural vulnerabilities then return to the normal or not? And this is also something that was completely not explored in the AR6. So I think these are important gaps that need to be taken into account for the AR7. I will talk very briefly on scenarios. This is work that I did in the past, but has come back and is haunting me these days. So the RCP 8.5 has received a lot of attention. And this is one example of scenarios. A lot of the literature has used the RCP 8.5 as the upper bound. And I'm sure all of you have seen a lot of scenarios with the RCP 8.5. The problem is the RCP 8.5 is no longer going to be considered in the CMIP 7, for example. And the reason for this is pretty straightforward. From a researcher point of view, you can see that this is the historical CO2 emissions. And you can see that the historical CO2 emissions is not expected to go up to these levels. It is supposed to even off. And this is mainly because of large renewable energy. We already know from India, from China, there's huge amounts of renewable energy, which means that the carbon emissions have decreased and are not expected to spike at the 8.5 levels. This does not mean that there is no climate change. It just means that the high RCP 8.5 may not come to pass. But this has received a lot of debate in the literature, with Trump being the classic example, saying that climate change is a myth and doesn't happen. So it's a problem of communication and how you communicate science in general. And this is also a paper that I did long ago, and you can see here that already for the air pollution emissions, how they develop throughout the century is not clear cut. They go down. Yes, they go down in many parts of the world, and I won't go into details, but there are a number of things that affect air pollution, of course, technology, but also institutions, fossil fuel reliance. All of these have a huge impact on how air pollution emissions also go down in the future. So coming to some examples from Europe, June 2026, they say, every year they say this, so you have to change the slides every year, because come June or July, they will say warmest year on record was this June, or last year was 2025. And it is true, temperatures have increased substantially in Europe, not all parts of Europe. So in Norway, where I come from, temperatures are still there, increased, but they are not what you would call heat waves as yet. But UK, for example, has faced a lot of heat waves, and this is, led to a lot of attention being coming back to this heat problem. And you can see here the June 2026 value is supposed to be plus 3.6 degrees higher than the normal. So Europe is the fastest warming continent. I'm sure you are.
Was it anomaly for Europe or UK? 3.0.
I think that is Western Europe. Western Europe. ECMW. And all of you are well aware, and I don't need to explain to this group of researchers here, Europe is the fastest warming continent, and there are various factors causing this effect in Europe. And one interesting factor, coming back to the topic, there has been lots of papers, and I was discussing this morning on air pollution reductions in Europe, perhaps contributing also to the increase in heat. But there are various factors, and this has become a huge issue, for example, for the Arctic, which is the fastest warming part of the world. And I live in Norway, which is in the Arctic, so a lot of studies on what should be done in the Arctic at the moment. And the mortality estimates I just saw, but I must say they are all news articles, so I don't believe them. But the mortality estimates, if you see Reuters, you see a number of articles, they say more than 10,000, some say more than 20,000. It is impossible to say. But in 20 days, 20,000 people dying is a huge number. And the question is why? Why are they dying? Why aren't we able to solve the problem in there? And we already did some work on attribution. Again, this is not so straightforward, attributing it to climate change. Again, I won't have time to go into the details, but we did do some work on attribution of climate change to a burden of how you can relate heat-related mortality to climate change. So we did some analysis. in the past, and we found that yes, climate change is a major driver for mortality. Even if you look at two scenarios which look at no climate change and then climate change, you can see that the climate change scenario does lead to an increase in mortality. So this is something that was established already, I think it was in 2023. And since then, there have been so many other studies that have looked at attribution of climate change. This is one example, and you can see here with the cities, how much is attributable and how much is a counterfactual scenario without the impact of climate change. And this is for the different age groups, and you can see here for the 85 plus age group, you have this high 1028. And again, this is a recent study, recent article that just came out, which looks at the UK and says in the UK, this was how much of the 42% of the estimated heat deaths we've seen will induce climate change in 2026. So there's lots of articles on attribution. So this is something very interesting also from the Indian setting to look into account in the future. And then if you look at the scenarios, we did some analysis where we looked at estimating future heat-related and cold-related mortality under different scenarios. And you can see that climate change will be responsible for an increase in temperature-related deaths per year from 3,079, this was a quota analysis in 2020, to 64,000, about 64,000 in 2100. So in general, there is huge amount of literature that says that the temperature-related mortality is growing, depends on which scenario you're in, but looking at the different scenarios, you will ultimately end up with an increase in heat-related mortality. And this is quite important for Europe as a large. Because in Norway, where I live, cold-related mortality is a problem, not heat. There is no heat, but cold-related mortality is a problem. So what people say in Norway is that, okay, it gets warmer, good for Norway. We stop dying. It's good because the mortality will go down. That's good for Norway. But that is the wrong way to look at it, because our projections show that in the long term, even if cold-related mortality, yes, does go down, ultimately heat-related mortality will take over in the next 50 years, and you will have a huge burden of heat-related mortality. So using this argument doesn't work, but a lot of people use this argument to justify not doing anything.
So even in Norway, you see that?
Yes. So we did an analysis for Northern Europe. I didn't have the numbers here, but we see it in Northern Europe that cold-related mortality is a burden and will remain a burden for the next 15 to 20 years, but eventually heat will take it. But of course, which scenario you're in, it has a lot of implications how much heat will happen. I can skip that. Coming to the air pollution issue, also we did some work on looking at whether air pollution and heat are linked together. And you can see here this is a change in the number of deaths from lung diseases in Europe in association with high temperatures according to different levels of air pollution, so PM 2.5. And you can see here that we did it in some cities, Oslo, Rome, and Berlin. And you can see all across that we have that, the higher the heat, the higher the pollution, lung diseases increase rapidly. And this is something we saw across Europe in all the cities. So this is also something to be taken into account that, pollution and heat work together and lead to increases in the burden, especially for respiratory mortality. We didn't see similar results for cardiovascular mortality. So this is also something to keep in mind. The kind of disease can make a huge impact on what results you get. Again, you can see here with the adaptation, we've done various studies on the adaptation, and it's not clear-cut. There's so many kinds of factors that go into adaptation, but in general, we see that cities with higher proportions of green and blue infrastructure, parks, streets, water bodies are generally associated with lower relative risk of heat stress mortality. But this is, of course, influenced by a number of other issues when you take into account adaptation factors. Okay, now coming to the issue, we have heat health warning systems in Europe, lots of them. So we did a study, a qualitative study, not a quantitative study. We did a qualitative study where we said, why do these heat warnings, what is wrong with these heat warning systems? Has anybody evaluated them or not? So we did an evaluation study and we did a scoping review of all the heat health warning systems. And we also did an interview-based study where we interviewed about 15 people who had developed these heat health warning systems and asked them, what is the problem with these systems? And again, I will not have much time to go into details. It was published, this was published in 2025. And you can see here that they're extensive in Europe but have not been evaluated. The benefits of these systems thus exceed their costs, thus far exceeds their costs. That is for sure, that there are huge benefits. But they suffer from ineffective implementations, issues of inclusivity, financing, and communication. And this might be the reason why we're still seeing so many deaths in Europe in spite of having so many heat health warning systems. So this is also something to take into account. And in interest of time, I will skip this. And just lastly, we also did some communication with policymakers, trying to see what were their implications. And this is another slide, which we published. We also did in 2020, just during the corona epidemic. And you can see here how health is accounted for, barriers and facilitators for the implementation of adaptation strategies. And you can see here that, in general, adaptation is complicated because it's interlinked. Many sectors are in account. So people are confused which sector is supposed to do what. And already in a very, very developed and a very communicative city like a country like Norway, they find it impossible. They're still working in silos, which makes it impossible for them to understand who is supposed to do what. So they agree that adaptation should be done, but nobody knows how it should be done. This is also proving to be an issue already in Europe. And just to say that this is a project that we're currently doing, which is looking at threats from heat waves, air pollution, wildfires in Poland. It's too early in the study at the moment. We're still in the first year, but I hope that this study will yield also more insights into how you can look at multiple risk factors together. Just doing what we have seen on India, this is not my work. This is work that I sourced from the literature, and I don't see this is from the Ingole et al. Paper, which is a classic paper which looks at the different studies that have happened on mortality in the South Asian region. And you can see here there have been a number of studies that have come out in the past few years. Maybe some of your studies are also here, but he has evaluated all the studies, and you can see there have been a number of studies that have started to come out. And you can see here the most classic example is the Bond et al. Paper for 2024. But this paper says, from what I've read of it, it says there are 116 excess deaths in India, in the cities. And I don't find that significant at all, that kind of number. So I think it's a question one has to, really understand. They only looked at 10 cities, of course. So they looked at 10 cities and they had mortality data for 10 cities. But one needs to really understand what is the basis for this and how one can expand the study then to further looking at all of them. There have also been some studies looking at heat waves in India and expanding it to a district level. So there has been some work in this area. And this is from a Frontiers Environmental Health paper that they looked at, and you can see here the top 15 districts by excess deaths, and you can see here the excess deaths are not very big. 300 deaths, 200 deaths, it's not very big number. So it's also a question, how do you convince policymakers that this is an important issue for South Asia? Yes. You have some comments? Yeah. Heat. That's related. They've also done work on pollution, actually. Bond et al. Also did a paper on pollution, and I have that maybe here. He concluded that if you do it with pollution, similar results to what we got in Europe, high heat and heat waves and pollution together will lead to more mortality. Classic, But what do you do? Nobody tells you what you should do, in this. So this is where I think we need to go forward in the literature. This was an excellent piece. I recommend you read it. I will not have time to go into it. This was written by Dr. Purvi Patel, whom I met last year. She's part of the GH, maybe of the network as well.
Yeah, now she was with NCDC, National Program on Climate Change. Now she's with Sustainable SFC.
Okay. So I met her last year, and I just came across. She just wrote this. It's not a comment. It's not an article, but it's a commentary that was written in the Monga Bay. And it's excellent. It talks about how there is a huge gap in the heat-related health literature in the Indian setting and what are the problems. And she talks about everything, cross-counting is inadequate, excess mortality and hospitalizations are better indicators simply because the heat stroke indicators that you have in India are not sufficient to capture heat-related mortality. There's an issue of definitions, reporting systems. She talks about universal protections, for example, that complement targeted support, should complement targeted support for vulnerable groups. So it's an excellent paper that talks about what are the gaps in current heat-related mortality in India. I found it very useful.
So is there any article that we have reduced the survey? Both, but we have reduced the survey. So we have reduced the that we reduce the pollution but increase atmosphere. Such kind of
I think reducing, if you reduce the pollution, and of course there are various articles only about sulfate, yeah. So
globally, basically European nations have reduced.
There's a couple of papers from China. There's a big chunk of sulfur reduction happening in China.
So the Chinese emissions have critically decreased because of these reductions in sulfate, mainly because of the coal burning issue. So there are implications over the long term also for the climate, but on the other hand, I think that is a very contentious issue. You have to reduce the sulfate anyway. It doesn't matter what it does for the climate. The fact that it produces huge health benefits means that the sulfate has to be reduced. So it's kind of a dark tunnel that you walk through in this field where you say you have to reduce pollution. It doesn't matter what happens to the climate. Ultimately, over the long term, you can worry about the climate. I think that's very important for policymakers. Otherwise, they will do nothing. Tell them reducing sulfate is not good. So just to close off, I think some points for discussion. I think based on the reading that I've done in so far for the Indian setting, I think there is a need for creating a detailed climate health indicator database for India. For example, I've not seen that as yet. It would be very useful, especially for IPCC researchers if things like this existed. Because right now we are dependent on all these papers and we have no idea, what this data is. So it would be nice to kind of put everything together. So the Lancet Countdown, for example, is a classic example where they have 50 plus indicators, but I have not seen those developed as yet for the Indian settings. I think there's a huge need to do that. And of course, health data can always be improved. All these papers talk about mortality, but it's unlikely that you just die. I mean, I always think that hospital admissions are way more useful, but hospital admissions in India have a huge issue. The doctors don't adequately categorize the type of hospitalization. So they say things like in India, it's you go in the hospital, they say heart stopped. Now, what does this mean? Heart stops when you die, that is clear, but they don't actually talk about why the heart stopped and what is the reason for it. So there's a huge, health professionals have to deal with so many patients, so they don't adequately classify the mortality and the morbidity outcome. So this is like
European country,
they are very strict, so everything has to be quite detailed, which is why these studies in Europe are so good because they get access to excellent data. So in Norway, you classify everything when a person dies or if they're admitted in the hospital, you have to classify the first reason they're admitted in the hospital, all the comorbidities that the patient has come with, and so on. But not the whole country. In certain hospitals, maybe. These papers base themselves off certain regions because that's where the data is good. But I think we have to do something to try to do something more at this, countrywide level. I think that's where we are lacking some literature. Of course, the design of integrated strategies, perhaps Sharath will talk more on that. It's not clear cut to me what kind of strategy should be implemented and how they can take public health into account. That is almost the end of my talk. I will also say that I was recently invited to be part of this group, which is, so I promised to put up the slide. This is led by a colleague in Singapore, and they include India, but they don't have data for India. We are very interested to gather data for India. So I think this is something, these kind of initiatives, it would be very good because then you can see the differences across the whole Southeast Asian and South Asian region as well. And the last thing that I should say, I'm also in this Lancet Commission, which is a completely different exercise on climate, health, and migration. And this is actually it's a different topic, nothing that I worked on before, but I've been called in as a climate scientist to help them, as an impact scientist to look at it. And it's actually a very interesting issue because you have huge amounts of internal displacements happening because of climate change. So when climate changes, people don't go abroad. This fear that Europe has, that we are getting a lot of climate refugees. This is nonsense. Nobody goes to Europe because of the climate. What traditionally happens is crops fail or something, because of droughts. And then they move somewhere else. It's a classic story of the urban workers who come from the rural areas. And this is increasing greatly in India. And I think this is also something we should invest more time in understanding what impacts and how these people are, how their health is affected. That's it from me. Thank you very much.
We can take some questions for Shilpa. Anyone? Questions? So you laugh about this mortality. What are the uncertainty of this?
In India one.
Yeah, India.
It's not my paper again, it's from the Frontiers paper, right? This one.
Yeah, exactly.
Yeah, this is a paper that I'm reading at the moment.
Because uncertainty will come with the hospital facility, everything. Like you see the dense population and then less hospitals, less facility. The mortality will be more. And if you go like more developed state, mortality will be less. No number of patients, but mortality will be less because of
Yeah. There, of course, a number, and comparing by states like this is problematic, especially in the Indian setting. As you said, there are completely different facilities available across the different states. And unless you kind of also homogenize for these health settings, these kind of numbers don't make sense. And I think that is what Purvi Patel and what I actually believe is very important is to first look at health systems and not look at just early warning systems. This is our, classic we say, because we are engineers or technologists, we think early warning systems is the answer. But what we should be doing is strengthening the health systems first before we can, and this is something governments don't want to invest in. So this is the classic issue.
Just to add to this point, I have another point. In the statistics of table what you are showing, they also list out the age and the different classifications of the patients. Because if you are noting down just the number, then maybe not all of them were exposed to the same degree of vulnerability because of their age or comorbidity or some existing illness issues, which might have been aggravated by the climate change or pollution issues. So, does this ever talk about those segregations?
I'm not sure in this paper, but it's a classic. We have published so many papers at least in Europe, and I'm sure it will be the same in India. We have extent data on age categories in Europe. I don't have any figure here from me, but you can see here we have all these age categories already in Europe, and it's of course a huge issue for older populations. And less issue if you're 25, you probably don't have huge vulnerability from heat. But of course, if you're already a patient with, let's say, diabetes or other kinds of sicknesses, you have higher vulnerability. This is classic established literature, not done so much in the Indian setting, I think mainly because of the lack of the health data, I think this is something we really need to do. We need to, do the same as the European studies. So I think that's where I'm highlighting. There's lots of things that
another potential factor could be that people are scared to expose all their illness to some extent, right? I mean, no particular physician or when the data is not properly tabulated.
And I think also, I've always wondered, is it that in India we already have the adaptation to heat? It is a very classic issue that we have already built up some adaptation to heat, right? So you have the vegetable sellers selling the vegetables, they don't die. I mean, it is unlikely that they will die. So why don't somebody ask, this is asked Dr. Dilip Pavlankar in Ahmedabad, and he was asked what, and it's a classic example, they don't die. So that means they have an innate kind of adaptation already. You develop a body adaptation to heat. So, comparing with the European studies is different because in Europe, 40 degrees is a heat wave. In Norway, 32 is already a heat wave. They're all sitting and they don't know what to do. And the houses, somebody was talking to somebody, the houses are not built for that kind of heat. They're insulated via wooden floors. The whole house is like a furnace inside. So this is the problem that they lack the capacity generally to adapt to the heat, and this is why it's such a huge topic in Europe. And maybe that's why they die. It could also be that you have higher death numbers in Europe simply because they don't have the adaptation. Whereas because we have the adaptation, maybe our numbers are lower. But this is something we need to prove more and more through the literature.
Interesting talk. Can you please go ahead? There is one slide you have written 42%. I just want to understand how you have
the UK slide.
UK slide, huh? That is something that just came out in the literature. It's not me, it's coming out from Antonio Gasparini, the London School of Hygiene and Tropical Medicine, because the UK has been very much in the news. If you know, in Europe, it has been hitting the news with large numbers of mortality, and then, the policymakers come and. Yeah. So it's so the way Antonio does his model is through time series analysis. He has data for Europe, for UK, for the past 20 years or 30 years. And then he looks at whether temperature has had an impact or not. And to do the attribution analysis, you usually have to do two scenarios, one with climate change, one without climate change. And then you have to compare whether there is an impact difference between the two. So I think that is what he did here. He just put this out because there's been so much.
for 1 year, that's right.
Yeah, this is only for 2026. Yeah.
So there is even based attribution.
Yeah. We can also do event-based just for the year.
Okay, we will move on to the next. Thank you, Shilpa, for a wonderful discussion and talk. Sharath?
Thank you. We are running out of time. So I'll continue on this topic, but I'll focus more on air quality. Our group is called Urban Emissions. We've obviously given a generous introduction of that already. Everything that I'm showing you is also online. Please go take a look. So what we do is basically databases for emissions and pollution for cities to use in their policy dialogue. And at the same time, we also build a lot of communication material to try to be as simple as possible to explain what it is that we do. Otherwise, there's lots of data. If you go to our website, it's all data. And but we want you to understand what it is that we do with this data. So please go take a look. Now, I'll quickly jump into some of the numbers. I want to talk about air quality in India. I don't have a rosy picture of this. It's complicated. This is the only positive slide of this entire story. We have really good guidelines. We have really good standards. Okay, for some pollutants, for PM 2.5 and PM 10, we still lack the same stringency as the WHO guidelines, but we are getting there. We are trying to improve that. When we talk about air quality in India, we are primarily focusing on PM 2.5, okay, primary particulate matter, but it's not alone. So if I take a chemical signature of that PM 2.5, wherever you measure, so you have a primary component and you have a secondary component. And both of them are very, very important in our situation. So this is where the complexity comes in and the story continues. Just looking at the overall air quality, the overall PM 2.5 data, this is a summary from a reanalysis field combining emission inventories, metrology, a big global model, all the monitoring data available from all over, and satellite data that's coming in wherever is available. Everything has been nudged and cleaned and put together. So we have a picture like this. So from 1998 to now, the numbers have increased. And it's always been increasing. The states, even the state ranks have pretty much kept constant over the years. Those also really haven't changed. The most interesting part is these orange, red, and brown bins. The percentage of population that's getting exposed to the poor air quality standard, the way we define it in our air quality index, which used to be 0%, now it's almost close to 20%. The population exposed to chronic, not on a daily basis, on an annual average basis, it has gone up to 20%. And the amount of the population, that is the area that's actually complying with Indian standard, not WHO standard. WHO standard 0%. Indian standard, what used to be 60% in 1998, it's now down to 20%. Okay. Now, very simple fundamental equation. Pollution is emissions over volume of air. Volume of air is dictated by meteorology, so we can't really have any control over that. So, emission, anything you burn, you get emissions, and those will become pollution. There is no such thing as green crackers. You burn it, emissions will happen, and those emissions will become pollution. Very simple as that. Now, are we consuming more or not? So this is where the equation gets very, very interesting. If you look at the coal consumption in India, that's where we are. From 2014 to 2026, there is a 77% increase on an annual basis. 2018 to 2026, 60%. I'll come back to this 2018, why it was so specific. I'll give a few other slides. Now, we look at COVID years in the middle, but availability of satellite data that also comes in. Okay, the diesel consumption, same story. 2026, 70%, this is 21%. this jump is, it's very, very proportional. It's very linearly going up. And it's pretty much, it's directly linked to transportation. Every sector has a story in this. Petrol has a very, very stark increase, because this is where we put in a lot of effort. Our motorcycles have really gone up, our cars have really gone up, and the change actually shows. So if you keep burning, if you keep consuming more and more fuel, it will show up in your emissions. And it is showing up in our concentrations as well. More you burn, more emissions you have, and more pollution there will be. So here, this is a summary of, this is where 2018 comes in. So this is a summary of European Space Agency's TROPOMIS satellite data, looking at annual averages at regional level. And I'm not focusing on a point, I'm looking at the entire airshed. So these are India's agroclimatic zones. There are 15 agroclimatic zones. So we can average that over those zones. If you look at between 2018 and 2023, NO2 has on average increased 10%. This is columnar. Across the region on an annual basis, okay, the numbers have increased 10%. So you will have higher numbers in certain hotspots. If you look at SO2, we have across the region at least 30% average increase. So this SO2 is coming from coal consumption. If you look at very specifically on central plateau, this is or western plateau, this Chhattisgarh area. So you have huge power plants. You have close to 15 gigawatts of power plant generation there. So you have that is increasing year by year. This is even more interesting. Aerosol loading. This is a product which is being used a lot in trying to understand the PM2.5 loadings. This is interesting. So I want you to look at the symbols as well. 2020 is the plus, is the COVID year. So it was the lowest on our charts. Okay. Now, compared to 2020, 2024, numbers have started to increase. Like if anything, they have in some regions, they're getting close to what it was in 2018. So this is the entire columnar loading across the region. But from a science perspective, for me, this is even more interesting. This is also from TROPOMIS satellite product, absorbing aerosol index. Okay. So this is not an absolute number, this is a residual number. The difference between index coming from the absorbing aerosols and non-absorbing aerosols. We have absorbing aerosols, we have dust, black carbon, and those things. Non-absorbing, you have sulfates, nitrates, fresh SOA. Yeah, those are non-absorbing, negative. If you look at this, 2018 to 2024, the number has been becoming more and more negative. Okay, pretty much in all the regions, number has gone more negative. And it's a residual number, which means in my composition, the chemical composition, I have more of the non-absorbing aerosols in the system over the years. Okay. So if I go back, I'm putting more nitrogen and sulfates in the system, they are becoming aerosols given life and given time. And they are becoming more, and we have more of the non-absorbing aerosols. Now, there was a very interesting conversation that Sachin has mentioned. When they have MAPN network, the black carbon network is there. So over the years, the black carbon concentrations have been coming down, right? So that is absorbing aerosols. So on one side, those things are actually coming down, but we're not focusing on the gases. Gases are going up. The secondary portion of the PM2.5 story is going up, and it is actually showing up in the index as well. Very interesting. Now, if you look at the distribution, looking at only at IGP, it's also very interesting. So if I look at the overall aerosol loading, okay, the mass hasn't really changed so much. It actually has been very consistent, but the peaks have increased. So which means that we have a lot more very solid, maybe cities, big cities are coming up, which are actually become bigger hotspots. Okay? Those have really increased in just 7 years. NO2, pretty consistent. So it's mainly because, one, we have increased our standards. Our vehicular technology has actually increased. In 2020, we introduced Bharat 6. So we went from Bharat 4 to Bharat 6 overnight. And it actually had a huge impact on the on the NO2 numbers. Okay? But overall loading hasn't changed because we bettered the standard, but the number of vehicles have gone up. So over the 7 years, whatever gains we had should have gained from the standard, we lost that. CO is a very interesting story. So this is primarily coming from a chemical conversion that happens between all the various pollutants, but also biomass burning. So there's been an increase in actually biomass burning in the Indo-Gangetic plain. It's actually showing up. This is again composite of across the IGP. So that's why it makes it more interesting. This is the same, the absorbing aerosol index that I mentioned. It has become more and more negative. This across the Gangetic plain, my chemical composition of aerosols have been shifting. Okay? That's why focusing only on dust is not going to solve our problem, because our problem is also becoming more secondary in nature, which means that we have to control those SO2, NO2, and VOCs that are coming into the picture. Otherwise, we will not be able to solve it because our loading is not going anywhere, but the chemical composition is going left. So in this product, you can't break it up. But if you look at it, then there is a binodal option. So it is. So you look at this is one mode. This is another mode. So you have to do some hand waving, and you can actually break this up a little bit. But from a general perspective, there are two modes in that data.
You mentioned that the VC is going down. Why is it going down?
VC is going down primarily because the standards have increased. Now, for example, even on most of the vehicles, your diesel vehicles that you have, you're now using Bharat 6. This is a Bharat 4. So the primary component is going down. So that is actually showing up. SO2, this has a direct linkage to your coal consumption. Across the IGP, you do have close to 100 gigawatts of coal power plants, and those numbers have actually increased. This is the more of an industrial component that really hasn't changed. But this also has a really good component to chemistry. This is something that needs to be studied. At the city level, things are also a little bit interesting. You can actually break it down a little bit more. Again, the aerosol loadings in Calcutta actually increased. NO2 pretty consistent. SO2 actually increased. This is a combination of not only they have two really old coal-fired power plants which they're not shutting down, and they actually have started to use more and more over the years. And they do have a lot of industries just outside the Calcutta boundary, and those have also started to crank up a little bit more. These are all annual mean, but one could actually break it up at a monthly mean and start looking at it a lot more details as well. Yeah.
So some of these analyses are individual years. So
yeah.
There could be huge internal variability due to the meteorology and other things.
Yes.
Is it consistent? I know there could be a difference.
Yeah.
So is that difference consistent if you take different periods?
Correct. So if I look at the same plot for AAI, this is on 2018 and 2025. So 18, 19, 19, 20, 2021, there is a very nice progression over the years. So I didn't put that up, but I actually have those images as well. So there is a very clean progression in wherever the province is showing. AOD is actually going more left. This is also more going left. So it's actually very clear. So Hyderabad, it's very Deccan. Things have not changed so much on the overall loadings everywhere. But this is, we feel, primarily coming from the construction activities have increased so much. There's a lot of low-income families across the city using not LPG and electricity. So that's actually contributing to the big jump in the severe concentrations there. But this is very consistent in Hyderabad as well. Same thing in Delhi. Delhi is like superstar. So this is where you can see the improvements, because there's a lot of effort being put in it. So Delhi, being Delhi, it's also a big region, close to 100 kilometers, and a lot of effort has been put into place to cut down on all the old vehicles. There's been a big shift with the express highways coming in. Almost 80% of the trucks now go outside, which used to come in even in 2018 inside the city. So it's been a huge change here. So you can actually see that. Same thing, because of a shift in the vehicle's movement that is actually showing up in SO2 as well. CO, this feels is a combination of different things, but this is in others plots, this shift was overlapping. But here, I actually, over the years, it actually disconnected itself. So it's a very interesting story how the entire chemistry is changing for us. Now, what does it mean? Like all this knowledge is there, a lot of information is there, a lot of learning is there, but it also shows us things are super complicated. Okay, they're not straight. And we can't just talk about only PM 2.5. We have to talk about the parts of the PM 2.5 as well. That's where the story is. Okay, the ozone, which used to be only a regional pollutant, now it's also showing up as a urban pollutant, and it also is a GHG gas. There's a huge linkage. If you look at the air quality index bulletins issued by the Central Pollution Control Board, now close to 5% of the days are actually showing ozone as a conditional pollutant. Close to 50-60% of the days is PM, either PM 2.5 or PM 10, but 5% of those days are actually showing ozone as a conditional pollutant, which was not there before. So again, that's only happening because our emission mixture has changed. Our chemistry is changing, which is becoming more suitable for producing ozone in the city. So what used to be a regional problem, now it is a urban problem as well. Again, the heat island effect is also a very, very interesting thing. So the classic example with the understanding is that heat gets trapped in our concrete, and overnight it gets released. Okay. But if we have a thick layer of haze hanging over the city, which is happening more and more and more, it also traps the heat. The heat that was supposed to dissipate at night time, it is getting trapped. So there is a bump even from that. So that's something that how much of that can be attributed to it is something that we have to understand. So it's not only about concrete blocking the heat or absorbing the heat and then doing the heat story, but also the air pollution at the same time. So there's a lot of linkages. There's a lot of new studies are also coming up on how more vehicles on the road are actually inducing more heat in the city. So this is a European example, but if we start looking at it, how much vehicles are actually idling on the road, all that heat, again, we are not only the heat coming from the sun getting trapped, the heat coming from the engines is also getting into the system, it's getting trapped. So this is where things get a lot more complicated. So you have the emission sources also contributing to the mix, you have general sun contributing to the mix, and you also have the chemistry contributing to the mix. Again, I won't go into full details because you guys study this a lot more than me. Again, this is a study coming from IIT Bombay a very long time ago. After this, many studies have been done. So you have more aerosol loadings, more aerosol loading in the column. It actually reduces your lapse rate, makes it stable, and the convection actually goes down, and you have lesser precipitation. When region by region, the story is actually different, but that's the general understanding. Okay? And before monsoons, pre-monsoon, we do have a very high loading. So this is where the question is, we can actually break that aerosol loading month by month and start looking at it. So pre-month, that aerosol loading is actually high compared to afterwards. I'm pretty sure it has a huge impact on how the convection is getting developed. Okay. So and then this is an older study, but the same study has been done at IIT Delhi by Sagnik Day et al. On how much more aerosol loading in the atmosphere is actually counter to our renewable energy. They're close to 20%. Actually, on the Delhi solar panels, they said some days we're losing about 30%. So we want to have mitigation programs in place, but air pollution is not really helping. But very important is the health. At the end of the day, when we talk about air quality, we want to talk about short term on an annual basis, on a chronic, on an acute basis. And we do get affected a lot, both from the WHO assessments and the HEI, State of Global Air Assessments. We do have a very high number, close to 2 million, combination of both outdoor air pollution and indoor air pollution. So if we want to get this down, we have to get down air pollution, how much ever it has linkages to climate change or not. So because this is more important than climate changes on a long-term basis. So we want to really focus on the short term. This is my last slide. When we do live in a very dynamic environment, but if we can make these messages simple enough that somebody who's taking the decisions understands, I think we will get each and every one of those components addressed. Okay. Thank you.
Can you brief urban emissions also?
Okay, so we believe in data, urban emissions, and then building stories using data. So like this. But more importantly, we want to make sure that the story is understood by everybody, not just by a technical person, but also when we talk to a non-technical person, we talk to a high schooler, we want them to understand these concepts. Okay. So what is the link between air quality and climate change? I want to be able to explain to a high schooler. So the primers that we design and then the courses that we deliver are always kept high schoolers in mind. At least my understanding is that if I can explain to a high schooler what I'm doing, hopefully I can explain to a policymaker as well. And at the core of it, everything we do, we always keep it open. It is not, we won't wait for get a publication out of it or anything like that, because we want to spread the methods, options, the resources that are available. So they're always open, and we are always open to take criticism and any enthusiastic statements to build more and more tools.
Thank you. Open for questions. Sarath, I thought it was interesting to see that you showed that UHI urban heat island with the kind of aerosol or the air pollution as a blanket. So I don't think we have much that kind of studies over India. No. And I think when we think about nighttime temperatures, this is a key component probably over India. Yeah.
So ideally, our body temperature is 25 degrees centigrade, and we sleep really well at 25 degrees centigrade. And when during the daytime you are exposed to like 33, 34, 35 degrees centigrade, you want to bring it down to 25, and it takes an effort. If your ground is not cooling fast enough to get down to the 25, your room is not getting down to 25. And what we're seeing now, especially in the winter time, that whatever heat is getting trapped in, it's not leaving. And it's going to have a huge impact. So that attribution has to be separated out. But otherwise, right now, we're only assuming that jo aa raha hai, wo ja bhi raha hai, and it's not. It's not, yeah.
This is some kind of research that we can take up.
The haze will trap the heat in.
Yeah.
Haze actually really would trap the heat in the night. So mostly trapping is often the black pattern. So in a visible radiation.
Yeah.
So you don't get visible radiation radiated back from the earth or in the urban structure in the night. So only way is to, the thing is that which will absorb. Infrared radiation is the greenhouse gases. Gases are trapped in the hazy layer, then only it will amplify. Otherwise, only concrete structure will release the heat, and that will delay the nighttime cooling. So I still have like some confusion on that. Why hazy layer will trap the heat more?
It's not just the hazy layer, but also having a layer of particles. When your ozone numbers are also going up, and that will also trap the heat a little bit. And your aged SOA is there. It's non-absorbing aerosol, so it's actually going to reflect it back. So that's also is there. When we have it's
infrared radiation in the night.
Correct. No, it's a theory, and this is not something that's been studied before. So there's a lot of scope to break this up.
For me, it's a nice talk, and I want to have a comment.
Hmm?
So good work, and since you can connect to high schoolers, so we from IMSP, India International Society of Students, we are having some kind of forum where we connect to colleges and students to make climate research to the society. So there we look forward for your participation.
Yeah, thank you.
Thank you. Any more questions? If not, a big applause for Sharath and Shilpa. Thank you for inviting our day. And we hope to take this discussion forward and have more collaborations and networking. Thank you. And tea is open with some chocolates from Norway. Thank you.